Welcome back to Jersey Matters. I'm Larry Mendte. People have run out to buy all types of things, preparing for the quarantine because of the coronavirus. They've gone out to get toilet paper and hand sanitizers, Lysol, and guns. Our Phil Andrews checks in with New Jersey gun dealers. Phil.
Yes, the great toilet paper buy-up of 2020 isn't the only craze that has people frantically going 2-ply-O, because during this COVID-19 climate, there's also a huge run on these. Gun shops nationwide are reporting an increase of sales, particularly from first-time gun buyers, as Americans brace for the worst amid the current pandemic. As a matter of fact, background checks for gun purchases through the FBI system totaled 2.8 million nationally in February alone. That's a 36% jump compared to the same month in 2019.
People are panicking for no apparent reason. You have a bunch of people who like to create mayhem, and they put stuff on social media and the internet creating havoc. And their followers think that there's going to be social unrest and they're going to break into their house and steal their toilet paper. The reality is, we don't know. There's no rhyme or reason for the uptick. In the last year and a half, sales of handguns have been really low. The manufacturers have laid off, they cut back, and that's the way it's been for a while now. This is unprecedented.
Mel Katz is the owner of Defensive Security and a federally licensed firearms dealer and certified firearms instructor here in Mercer County. And one of his biggest concerns is what the climate will be moving forward if the economic situation continues to worsen.
Social unrest is a big question mark because people are losing their jobs. They're not getting paid. They have no money in the bank. That's the scary part.
And that's the type of thing you think can set someone off, right?
Desperation. It's like anything else. It's survival.
Of course, you would think that this situation would actually create a financial windfall for Katz, but like other retailers, he is at the mercy of supply and demand. He can sell you a gun, but not the ammunition to go with it, because he says people are hoarding that too. In Mercer County, for Jersey Matters, I'm Phil Andrews.
And now, separating the fact from the myth about the coronavirus from Dr. Diane Calello with the New Jersey Poison Control Center. Thank you for being back. I appreciate it. How are you involved in this?
So the New Jersey Poison Center is a 24-hour hotline, which people normally call if they're exposed to a poison or a toxin. But early in the coronavirus outbreak, we partnered with the Department of Health to provide a 24-hour coronavirus hotline through the Poison Center.
We've seen fear over this. We've seen some schools closing. We see the stock market dropping. People are going out to buy surgical masks. People are going out to buy food supply.
Right.
How much of that is unfounded?
Well, I think it's important to realize that right now our activity here in the U.S. is fortunately still very low. And the news can be scary. We're reading all about all kinds of things happening abroad, but some of the news is true. Some of it is meant to induce panic, and I think right now it's important to not panic.
Right? Why? It's important to not panic because the panic itself can be worse than the disease.
Absolutely. I mean, right now I am more worried about the consequences of panic than I am about the virus, which is, still much less of a threat in the U.S. than regular flu, which is rampant.
30,000 people died from the flu last year.
Right.
And we don't talk about that. The year before, in a particularly bad year, 60,000 people died from the flu, and yet people won't get their flu shot.
That's right. Exactly. When you lay flu compared to COVID-19, which is now the name of this virus, you're much, much, much more in danger of flu and a complication or even dying from the flu in the U.S. than you are from COVID-19.
Let's talk about COVID-19 and the coronavirus, because that to me is fascinating. The coronavirus is just a virus that when you look at it under a microscope, it looks like it has a crown. That's why they call it the coronavirus.
Yep.
But it's a very common virus.
It's a common group of viruses.
Yeah, and this is just a horrible strain of it,
That's
right? This is a deadly strain.
It's a strain,
So you can go to the doctor, right, and be told you have coronavirus.
That's right. Coronaviruses are a group. We know that, for example, the SARS virus was a coronavirus, and COVID-19 is a coronavirus. But coronaviruses cause things like common cold. So you could go to the doctor, get tested for just viruses, and be told you're positive for coronavirus, but it's not this coronavirus.
Should we expect the worst at this point? I mean, you would believe that from the media coverage, that this is coming, that we should have to be prepared for it. How much of that is true?
I think we're likely to see more activity in the U.S. because the virus spreads in people with mild disease. So sometimes people don't know when they have it. That makes it hard to fully contain. So we shouldn't be surprised and we shouldn't be alarmed if we see more cases in the U.S. And we shouldn't be surprised or alarmed if we see it in New Jersey.
You expect that?
I think that will likely happen just given how much the virus can spread without you even kind of knowing that you have it. But it doesn't mean that we should be preoccupied with worry or panicked.
Well, it's funny because I watch CNN, Fox News, I watch the media reports, and I watch ABC and NBC, and
Yep.
they constantly are telling you about the virus and how it's spreading and how it's going to come here and what you,
Yep.
but they never tell you what you can do.
Right.
Like they never tell you how you might be able to prevent it. Is there a way?
There are a number of ways. So the CDC, I have to say, has put out such a continuous stream of accurate information, and the CDC website contains a lot of resources. And one of those pages is something called non-pharmaceutical interventions. What's that? It's things you can do without drugs or medication to help protect yourself and control spread. It's common sense stuff, right? So it's washing your hands, it's covering your mouth if you cough or sneeze, it's not going to work if you're sick, it's avoiding contact with sick people, it's wiping down surfaces, it's all the stuff that we should do in the middle of flu season to prevent us from getting the flu is the same stuff that can protect you if you happen to come into contact with somebody with COVID-19.
It's funny, I asked a doctor one time, I said, how can you live longer? He said, do you smoke? I said, no. He goes, do you wear a seatbelt? I said, yes. And he goes, wash your hands more.
That's right.
That was so
washing saves
people
lives.
hear that and don't realize just how important
Right.
that is, what you're talking about. We're almost able to learn from the mistakes of the West Coast because you just had a case where someone went to the hospital, they weren't tested for the virus immediately. Right. They was assumed they didn't have it almost immediately.
Yes.
So they could have passed it to a lot of the medical workers. And they apparently didn't have the medication, I guess, to treat it there. They didn't have the training or the medication or the protocol in place. I would imagine that's not going to happen in the rest of the country now.
Right. The case in California arose because you can't test everybody who thinks they might have COVID-19, or you will exhaust your resources for the more, for the people who really need the COVID-19 testing.
Yeah.
But in response to that case, the CDC changed all of the criteria for testing. So even if you have somebody who maybe doesn't have a travel history that would qualify them for testing, if they have severe respiratory disease and their doctor thinks they need testing, they get testing. And that kind of changing response, adaptive response, is what's happening every day right now.
It's ironic that we just had this big vaccination fight in New Jersey, in Trenton, and it turned out that the anti-vax people won, and now you have the whole population wanting a vaccine.
That's right.
For knowing how important that is. It's amazing how things change in necessity.
It really is. You have a disease that for whatever reason, be it the media coverage or something, is really scary to people. And people are clamoring for vaccine coverage when we've got an equally scary disease right among us right now, which is influenza, that we still constantly debate about influenza vaccines.
But to the original point, when we go back in our conversation, it's a shame that we don't get this much coverage about the flu, which kills substantially more people in this country. Another good thing that came out of it, I don't think the CDC's funding will ever get cut again.
Yes. Fortunately.
Thank you.
All
Thank you for coming in. I always appreciate talking to you. Dr. Diane Calello, Medical Director at the New Jersey Poison Control Center. During the quarantine, where do you eat? Not to worry. Coming up, we'll tell you about a lot of people that would like to deliver the food right to your door. That's when Jersey Matters continues.
it's Ian Armitage from Young Sheldon.
This is Annie Pye.
It's me, Sonequa Martin Green.
It's Phil Kogan here from The Amazing Race with some crazy hair for a crazy time.
If you're anything like me, you're at home glued to your TV.
Checking the news, checking our phones.
Whenever I'm scared, I always look to my family to get a little happiness or a little laughter.
We want you to know that you are not alone.
You're not alone.
You're not.
We're still connected.
We're still us.
We can still laugh
And smile.
Still share moments.
And be happy.
That's what I'm going to be doing.
This is a time when we really need to focus on what's important.
Let's be responsible.
We are here for you, all working together.
Stay safe.
Take care of yourselves.
Take care of each other.
It's really important to remember that we are all in this together.
We're all in this together.
We're all in this together.
We are all in this together.
And we will get through this as we always do.
One love, y'all. Peace.